I'm Deborah Long, and my slideshow today is on the detrimental effects of antibiotic use in livestock. Thesis statement. Excessive antibiotic use in the livestock not only pose significant health risks to animals, but also contributes to proliferation of antibiotic-resistant bacteria, threatening public health and necessitating urgent regulatory measures. Several factors that are related to my research. Number one, public health implications. 80% of all antibiotics are used in the livestock industry, not human consumption. Barton and Chang's research highlighted the impact of antibiotics use in animal feed and on human health. It highlights the misuse of antibiotics in human medicine and the use of antibiotics in animals' feed to promote growth and to prevent infection. The Swan Report of 1969 was one of the first of its kind. When it came out, the U.S. turned a deaf ear to it. It did not really want to acknowledge that there was any kind of link between the dangers of antibiotic-resistant bacteria transmitting from animals to humans through the food chain. Although Barton's was an advocate for enhancing the oversight of antibiotic licensing and prudent use codes for farmers and veterinarians to follow. I think the U.S. didn't want to listen to the effects that came out in this report because they were industrializing the livestock industry and were more focused on growing that instead of the effects of the human health. The development of antibiotic-resistant disease in human medicine is often linked to agriculture antibiotic use. However, there is limited data on the risks that poses by agriculture. This is because the corporate farms outnumber the small family-owned farms now, and you can't get on to test the soil, the water, the animals. Everything's kept under lock and key, so it's very controlled. That's why there's so much limited data. 3 potential mechanisms include direct infection with resistant bacteria from animals, break in the species barrier, and then transfer of resistant genes from agriculture to human pathogens. They were for regulations to be put in place to find different strategies of the overuse of antibiotics in the livestock industry. The livestock industry wants to grow livestock with the use of antibiotics. They say they can grow them quicker, faster, healthier. They gain weight faster so they can sell them quicker and get them to market. And they're doing this by confining them in a smaller area that is unhealthy and breeds more disease and bacteria in the animal, is why they need more antibiotics. The environmental impact. Cabello studied the heavy use of prophylactic antibiotics in the aquaculture. Particularly, developing countries had negative impacts on the environment and human health due to the rapid expansion of finfish. Aquaculture. These antibiotics, non-biodegradable and essential for human medicine, persist in aqua environments, causing a long-term selective pressure for antibiotic-resistant bacteria. The emergence of antibiotic-resistant bacteria in aquaculture environments, transfer of resistant detriments of bacteria, and charge in water and sediment, bacterial flora, are key issues. The article calls for international incentive regulation for the antibiotics in aquaculture. The study of Zoe investigates whether reducing antibiotic use in livestock production can mitigate the spread of antibiotic resistance into soil. Earthworm guts. because the worms are in the soil. The animal eats the antibiotics, it goes through intestines, goes through the stomachs, it's excreted out through manure or urine, and now it's going to be in the soil. And that's how the earthworm, now they're studying the earthworm because they're showing effects in the earthworm. It examines antibiotic-resistant genes, also called AGRs, mobile genetic elements, MGEs, in the environments. The research find that reduced antibiotic uses does decrease the abundance of the certain ARGs and the MGEs, suggesting that lowering antibiotic use in livestock could help mitigate the spread of antibiotic resistance in agriculture ecosystem. Here again, earthworm is part of our ecosystem because it's in the dirt and not only affects us as humans because the animal ate it and we eat the animal, but it's also getting in our soil, our water. And when the manure from these huge hog farms are being sprayed on fields for fertilizer, it also can be dried. And then when the wind picks up, it's going to blow it to humans. Or if it rains, it's going to wash it off the plants and then into the water source and into the soil. So it does affect our whole total ecosystem. Number 3, regulatory measures. This is so important. Barton's article in Nutrition Research highlights the risk of antibiotic use in animal feed on human health, the need for regulation to prevent antibiotic growth, and the need to regulate licensing and encourage producers and farmers and veterinarians to work very closely together. It is also important for unbiased opinions that are uninfluenced by lobbyists who are being paid from the chicken, egg, beef, dairy, swine industry, because their main interest is to keep these industrialized farmers going and not to ruin the livestock industry financially. The livestock industry believes that the use of antibiotics is to prevent, treat disease, increase feed efficiency, and substitute labor that would go into the care of individualized animals. They also use less space and also, like I said, breeds more unhealthy living conditions. So therefore, they're going to need more antibiotics in the animals. This is a vicious cycle. However, it's been going on for the last 8 decades. Growth in livestock and agriculture industry has happened because of the use of antibiotics. They can produce more animals at a quicker pace and then give the consumer a cheaper price at the checkout, making them more dependent on the use of antibiotics. And by doing this, like I said, the consumer does get a cheaper price when you go check out. However, the USDA needs to make informed decisions that are unbiased for the betterment of mankind, or are they just making them for the betterment of the livestock industry? Even if policies are put into place, who's going to enforce these policies to the corporate farmers? Livestock producers need to become more responsible with the use of antibiotics, and this could be lessened, but would cost more in the long run to produce an animal from birth to market because it's going to take a longer time, more feed, more hands, more help, more space to provide them with a better living condition. Although this does give us a healthier animal that's being raised in a more humane condition. Number 4 is One Health approach. Antibiotic resistance, or also called AR, is a complex global health issue that poses a significant threat to the environment, humans, and livestock. It is considered a One Health issue due to its interconnectedness to livestock, humans, and our environmental components, creating pathways for the transmission of antibiotic-resistant bacteria, ARB. The overuse and misuse of antibiotics have been a primary cause for antibiotics resistance, which is expected to result in 10 million annual antibiotic resistant associated deaths by 2050. The future of healthcare is uncertain due to the effectiveness of antibiotics and treating infectious diseases caused by antibiotic resistant bacteria. So we're going to have more research because we've got to come up with new antibiotic drugs to fight basic strains of diseases that are coming out because you can't treat them any longer with antibiotics that are already known. So One Health acknowledges the interconnection to mutual influences of the three domains, focusing on achieving optimal health for domestic animals, humans, wildlife, plants, and the environment as a whole. The local and global dissemination of AR can be attributed to ineffective infection control policies, contaminated environments, and inadequate antibiotic use in both livestock and humans. The development and dismissment of antibiotic-resistant bacteria and antibiotic-resistant genes are facilitated by the neglect humans use of antibiotics, which can be transmitted to humans through direct contact, food, water, and environmental surfaces. The absence of appropriate policies and regulations for the use of disposable antibiotics exacerbate this issue. Historical perspective. Let's talk about that. The proceedings of the Fourth International Symposium of Antibiotics and Agricultural Benefits and Malefits. Let's talk about the pros and cons of antibiotics. This book talks about that. It improves productivity, and you have a healthier animal. Prevention and treatment of infectious diseases in livestock. That's what they're using antibiotics for. And also control bacteria contamination to enhance food safety in the supply chain. Okay, the cons are the emergencies of bacteria that are resistant to antibiotics. Animal products and the environment contain residual antibiotics. Potential adverse effects on human health due to antibiotics resistance. Like I said, that's costing us more money in healthcare. People are sicker. It's also happening to younger people that are normally healthy. So it's costing us more money in healthcare, but then also we need more research in the labs so they can keep coming up with more antibiotics to fight these resistant strains. Health implications. According to Barton, like we talked about, antibiotics are widely used, and they're doing it to get healthy animals quicker to market. However, it's given us adverse health effects. The animals are becoming resistant to the antibiotics, and then they're passing it down to human life because we're eating the meat. It's getting in our soil, it's getting in our air, it's getting in our water. So you can see it is a whole ecosystem, it's a whole chain, it is a cycle that has to be stopped. Proliferation of antibiotic-resistant bacteria. We are coming up with genes that are resistant to human pathogens. It's contaminating our food chain. The transmission of antibiotic-resistant bacteria is from livestock to humans. And without the livestock industry stopping the overuse of antibiotics, how are we going to stop this? Because we have to save the human population. Without these urgent regulatory measures that need to be put in place, it is a public health risk at this point. It is that dangerous without new laws put in place and for these farmers. In conclusion, as we say, excessive antibiotic use in the livestock industry poses a significant health risk to animals and humans. And here is my list of references.